So I'd like to welcome you all to the School of Public Health and Family Medicine's weekly noon talk. And this particular noon talk is being hosted by the Division of Environmental Health. I'm Professor Andrea Rother. I'm the head of the Environmental Health Division, and I welcome you all today. We are fortunate to have two presenters today who will be taking us through a very timely and important topic on air pollution and COVID-19. So just briefly about the two presenters. James Irlam is a senior lecturer in primary healthcare directorate at UCT, and he's also an associate with our division, the Environmental Health Division, where he convenes a course in the MPH Environmental Health track. He's a graduate with an MPhil in epidemiology and an MSc in climate change and development. He's also chair of the special interest group of the Public Health Association of South Africa's Climate and Energy and Health Special Interest Group. And if you aren't a member and would like to be a member, we can discuss it at the end, and I encourage you to join. We also have Rico Euripidou, who is Groundworks, which is an NGO in South Africa, environmental health campaigner. He's trained as an environmental epidemiologist at the London School of Hygiene and Tropical Medicine and Contaminated Land Management in the UK. His interests lie in working on issues to do with energy policy, climate change, and public health. So again, I welcome them and thank both of them for taking the time. We will go ahead with the presentation, and I ask you that you just note any questions you may have. So James and Rico, over to you.
Right, thank you, Andrea. Good afternoon, everyone. I trust you can hear me okay. Welcome to the seminar. I'm pleased to be sharing this with my colleague Rico, who together with others in the school form the executive of the Climate, Energy and Health Special Interest Group of the Public Health Association of South Africa. The interest group was established in 2017 to advocate for healthy and progressive energy policy in South Africa. So I'll begin the presentation by sketching some of the connections between climate, energy and health, and specifically the impact of air pollution. Rico will then present on the impact of COVID-19 lockdowns on air pollution. And then I'll discuss a critique of three recent ecological studies on the impact of air pollution on COVID-19 morbidity and mortality. Rico will summarize recent global calls for a healthy recovery from the pandemic that prioritize air quality. And then finally, I'll invite you to join our call for strong public health leadership for a healthy recovery in South Africa, and for fossil fuel divestment by our UCT Council. So looking at connections between climate, energy and health, these key messages are ones that our interest group presented to a parliamentary hearing in 2018 on our integrated resource plan, and they remain relevant today. So I'll briefly explain the first 2 points before handing over to Rico. So energy is a major public health issue in South Africa. In 2016, Mike Holland, an air quality expert, was commissioned by Groundwork to undertake a study of the health and economic impacts of Eskom's coal-fired power stations. And you can see in the figure, he came up with over 2,200 deaths per year being attributed to those emissions. Deaths from lower respiratory infection, from lung cancer, from strokes, from chronic obstructive pulmonary disease. Morbidity in the form of cases of chronic bronchitis in adults, bronchitis in children, asthma symptoms, hospital admissions, and then lost working days and days of restricted activity, which total and the figure in excess of $2.3 billion per year. In 2007, this report, Broken Promises, was produced by Groundwork, and it reflected on the fact that despite the establishment of the Highveld priority area in 2007, that 10 years later, not much had changed in terms of the toxic air pollution affecting millions of people in Gauteng and in Mpumalanga. In July 2020, Groundwork instituted a court challenge against the Minister of Mineral Resources and Energy to give reasons why new coal is included in the Integrated Resource Plan of 2019. And this decision appears to ignore the severely negative implications of coal for our health and well-being, for our climate, air and water resources, and our electricity prices, despite decreasing renewable energy prices worldwide and significant solar and wind potential in South Africa. The next message is that health is a bottom line of climate change. This figure from the 2015 Lancet Commission on Health and Climate depicts the multiple and complex pathways by which greenhouse gas emissions impact health, such as undernutrition, mental health, and vector-borne disease. And we see in particular on the right the impact of particulate air pollution on cardiovascular and respiratory disease. This figure from a 2011 review of the epidemiological evidence shows the multiple health impacts of particulate air pollution, toxic metals, and ozone from coal-fired power stations on the brain, lungs, and heart, and on systemic inflammation and the development of the unborn. And the WHO has also estimated that air pollution causes an estimated 1 in 8 deaths worldwide per year, and accounts for 1/3 of the combined deaths from lung cancer, stroke, and lung disease, and 1/4 of the deaths from ischemic heart disease. Okay, so at this point, I'll hand over to Rico to take us through the next section.
Thanks, James. And thank you to Andrea and to others who have organized this, and for the opportunity to share some of our work in the special interest group. So over the next 7 slides, I'm going to talk a little bit about what happened to air pollution over South Africa before, during, and after our national lockdowns. And what you see on this slide is satellite information showing some pictures of air pollution in South Africa over the air column pre-lockdown and post-lockdown. And this is possible because we now have these European satellites that have these air quality measuring capabilities for nitrous oxide and sulfur dioxide. And what they do is they measure the air pollution in the air column over the whole country. So they almost take a snapshot of air pollution over the whole country. Unfortunately, they do have some limitations. They only fly over once a day. So what we see is a snapshot from, I think it's a midday snapshot. So it happens at 1:30. And that means that it excludes our peak pollution periods. But even with that in mind, if we look at the figure on the left, that is for the concentrations of nitrous oxide in the air column. And if we look at the small picture of South Africa on the left, on the extreme left, that is a pre-lockdown snapshot. And then the figure on the right is a post-lockdown snapshot. and it shows how much the air pollution has decreased. So the less intense the color, the less intense the air pollution. And basically what the graphs show is that there are dramatic drops in air pollution over the Highveld by approximately 1/3, in particular for these two pollutants. If you look quite carefully, you'll see little green dots. Those signify the power stations. So you can see on the right-hand side for the SO2 graph, on the bottom, you'll see little green dots, and those little green dots show us where the power stations are. And that just shows you how responsible that particular sector is for this particular air pollutant. Can you go to the next slide, please? And if we look at the information on the ground, it kind of reaffirms these satellite readings for these pollutants. So the first slide looks at, again, nitrous oxide, and it shows you from where the dotted line is to the left of that. You'll see the readings leading up to our national lockdown on March 27th. And from the right-hand side of the slide, you can see the dramatic decreases in air pollution. And these stations that are reflected, these air quality monitoring stations, range all the way from Phalaborwa, Mafikeng, to Springs, to Standerton in the middle of Gauteng, down into the Vaal, to Sebokeng, and also include Middelburg and also Lephalale up in the Waterberg. Next slide, please, James. And this, no, sorry, James, you've gone too far. One back. Yeah. So this slide looks at, again, this is for carbon monoxide. And again, the same pattern emerges for carbon monoxide. And the reason for that is because it's associated with large combustion installations. So what happened during the lockdown period? Why do we see these dramatic falls in pollution? One of the main reasons is because Eskom, the demand on Eskom for energy dropped by about 1/3. Eskom was producing about 9,000 gigawatts less electricity. That's equivalent to about 2.5, 3 coal-fired power stations. And also, there were less cars on the road, and there was less heavy industry operating. Next slide, please, James. Now, if we look carefully at this slide, it tells a slightly different story. Please go back a slide, James. This slide tells a slightly different story. And the reason for that is because what we are looking at now is the air pollution on the ground data for particulate matter of the size 2.5 micron. And this is an important criteria pollutant because globally it is known, and in the literature, this is the pollutant that people are most closely looking at. It's the pollutant that penetrates deepest into the lungs. It mixes in the oxygen exchange. It circulates around the body, and its composition is made up of tiny bits of metals, of toxics like cadmium and lead and mercury, as well as dust, tiny bits of dust. And it's the inflammation around the body that is associated with this pollutant that has the massive public health impact that James was talking about earlier. And if we look at the pre-lockdown period to the left of the dotted line, and the post-lockdown period, we can see that the levels of pollution didn't really change that much. And that tells us the story of of how inefficient our coal-fired power stations are to capture pollutants like PM 2.5. So that's the story that tells. If you go to the next slide, please, James. This is, I think you've gone one too far. Similarly, okay, never mind that slide. There was another slide showing particulate matter PM10, and thank you, James, that's the slide. So you can also see that the concentrations of PM10 didn't, there was hardly any change pre-lockdown and post-lockdown. And that can be attributed to, for instance, dust roads and coal mines and things like that, that kind of industry that also didn't shut down during the lockdown. And you can see that we have limited potential to control this kind of pollution that also has a big public health impact. Next slide, please. So one back, please. So while James goes back to that slide showing what happened in the rest of the world, the way that the air cleaned up in some places during this COVID lockdown, the take-home message for us is that it's really a remarkable testament to just how unsustainable our normal economy is, and how normal development is not congruent with good public health. So if you look at these slides, they show nitrous oxide levels in India and in Italy, pre-lockdown and post-lockdown. And again, we see similar decreases for these pollutants that are associated with traffic, high vehicle traffic, and also from large stationary combustion sources. And you know, in India, some people were seeing blue skies for the very, very first time. Those that were living within eyesight of the Himalayas were seeing the Himalayas literally for the very first time in their lives. So it just shows us how unsustainable the normal economy and normal development is. And this kind of air pollution, as you can see, it spans massive areas. So millions and millions of people are affected in these snapshots that we can see. Next slide, please, James. Yeah, so as James demonstrated earlier, how dirty air can be associated with these massive public health impacts and also massive public health costs. So in the same way, clean air can be associated with public health benefits and also cost savings. So in these two graphics, what we see is some research that was done by a group called the Center for Research on Energy and Clean Air in Europe. And their study estimated that there were approximately 11,000 fewer deaths in Europe over this very short lockdown period. They also estimated that there were 1.3 million fewer days absenteeism, that there were 6,000 fewer children that were developing asthma over this short three-week window, that there were approximately 2,000 avoided emergency room visits. So you can see when you look at the negative health impacts and you compare them to the positive health impacts, you can see how the costs add up very, very quickly. And a little bit later, we'll talk about some arguments why a healthy transition for clean air makes so much sense, not just from a public health perspective, but also from an economic perspective. Thanks, James.
Okay. So apologies for the slide advance. There seems to be some issue here with the browser window. So the question of whether there's an impact of air pollution on COVID morbidity and mortality has attracted a lot of media attention, as seen by this recent selection of popular articles in the Guardian. And these are the 3 ecological studies that have been extensively quoted in the media and which have been critiqued in the European Respiratory Journal after they were fast-tracked to publication. The title of this critique in the journal, Go Slow to Go Fast, refers to a warning in industry against sacrificing product quality in the short-sighted drive for speed. And likewise, the authors of this critique argue for sustained research rigor in the long-term interests of getting the evidence straight. They state that present studies on the role of air pollution and COVID-19 spread and prognosis do not fulfill quality criteria and are at present not sufficiently informative, and then provide some comment on those 3 studies. In the first ecological study, Wu et al. Looked at 3,000 counties in the US and found that a 1 microgram per cubic meter increase in PM2.5 had a 15% increase on the COVID death rate after adjustment for 16 variables, but they later updated this with a further 4 confounders, which halved the increase to 8%. The second smaller study used data from 66 regions in Northern Europe and made the claim that long-term exposure to nitrous oxide may be one of the most important contributors to COVID-19 deaths, but they performed no standardization or adjustments for basic variables such as population size and age distribution. And the third study looked at 120 sites in England and found positive associations, but again, there was no adjustment for confounding variables. So in summary, the design of ecological studies rendered them prone to ecological fallacy, and the validity of these studies is further compromised by no adjustment for potential confounders, inadequate measures of disease frequency, and failure to account for the dynamics of the disease. The studies also failed to adequately explore the effect of air pollution on the variables that determine the spread of infection or the reproduction number, or naught, namely transmissibility, contact rates, and duration of infectiousness. And so the authors conclude by calling for multidisciplinary research collaboration using high-quality temporal and spatial data on both exposures and outcomes. Rico, over to you.
Thanks, James. So as the world is responding to this COVID-19 pandemic and all these kind of intertwined social, political, and economic crises that kind of arise as a result of it, we find ourselves now at a crossroads. And we can begin to make decisions about how we respond. So one way we can do it is by going back. We can go back in the direction that we came. We can prop up old structures and old systems, and we've already seen evidence of that after the 2008 economic global crisis, and in the 2018 and after that global economic crisis. We literally looked backwards and we funded the same institutions, we bailed out the same banks, we bailed out the same kind of industry. But what this particular pandemic does, or this particular moment does, it also gives us an unprecedented opportunity to think about a different future. And the WHO, make no mistake, is generally a very conservative organization. It is made up of its member countries, and they have a governance structure that is by no means what would be considered hugely progressive in the world. But having said that, the WHO has come out with this idea of a manifesto for a healthy recovery post-COVID. And it talks about things like the urgent need to forge a new way of developing more equitable, more resilient societies that speak to not just indicators of universal healthcare, but talk about indicators of decent work, indicators of basic services, and within the framework, within the overarching idea of having a healthy climate. Because the idea is that without a healthy climate, we won't have healthy societies. So WHO makes these very, very strong interlinkages between healthy human societies, healthy natural environment with clean air, clean water, healthy food production. It recognizes the risk of emerging infectious diseases through habitat and biodiversity loss. It talks about how we need to think about investing in essential services, from water, from sanitation, from to clean energy for healthcare. We need to think about what a healthy energy transition looks like. WHO recognizes that over 7 million people a year die from exposure to air pollution, which is 1 in 8 deaths of all deaths globally. 90% of people globally breathe outdoor air pollution that exceeds WHO air quality guidelines. Those air quality guidelines were established in 2004. They're hugely outdated. WHO are in the process of re-looking at those guidelines, and colleagues from the MRC are on that panel that are doing that. So these 2004 guidelines will be massively revised, considering how much more information and how much more the world, the global scientific community knows about the impact of air pollution. So it's not just NGOs, it's not just special interest groups like ourselves that are saying this. It's also mainstream intergovernmental organizations that are saying this. Next slide, please, James. So within this manifesto for a healthy recovery, there are 6 kinds of calls to action. These are, sorry, James, one back. There are, one back. So there are 6 overarching actionables, and within those there are specific recommendations for each one of them. So for under the idea of protecting and preserving the source of human health by protecting nature, they talk about mitigating climate change through sustainable infrastructure development, about being having stricter approaches to establishing and enforcing air quality standards. James showed how the report that we released demonstrates that even our ambient air quality standards that we've established using WHO as a reference guideline are exceeded most of the time in our priority airsheds, which is where most of our people live, in Gauteng and in the Highveld. And they basically provide roadmaps for air pollution, clean energy, sustainable and healthy food production. They come out very strongly and say that we should stop using taxpayer money to fund air pollution. Coincidentally, the US EPA has an ongoing, every 10 years, they do a cost-benefit analysis of their air pollution legislation. And They use a methodology, quite a well-known and standardized methodology now, called BenMap. And what they found is that for every $1 that has been spent on air pollution mitigation, they've made a $30 saving on health and socioeconomic benefits. So the case for mitigating air pollution and for spending money on air pollution is a good case. Next slide, please, James. This this slide speaks to an initiative by over 40 million health professionals around the world coming under the banner together of the Global Climate and Health Alliance, and also WHO is part of this alliance. So what they did is, the idea or the premise of this is that health professionals are among the most trusted people in society. People trust doctors and nurses more than they trust anybody else. So messages that come from the health sector around healthy recovery, healthy energy are internalized by people when they come from these health professionals. So in this case, over 40 million health professionals associated with 350 organizations and 4,500 individual health professionals from over 90 countries. We all wrote to the G20 leaders calling for a healthy recovery, to show that we all stand united, and that we need this kind of science-based approach to address COVID. So it's quite a strong signal, and for those of you that are health professionals, I would encourage you to look at this particular campaign and to think about your, possibly your role or your contribution in this respect. We all have to make contribution to a healthy recovery if we are to have a healthy recovery. So we also have to kind of examine what it means for us personally. Next slide, please, James. The next slide speaks to a South African initiative, which is being coordinated by 350.org. It's called the Climate Justice Coalition. And again, it's also premised on the idea that we can't go back to normal. We have to conceive and reimagine a different future that speaks to, that puts health and that puts people first. So it's premised on these 5 principles that you can see on the right-hand side, that we need to put people's health first. There should be no exceptions, that economic relief should go directly to people, that we should think about workers and communities and not corporate executives. We should be bailing them out, that we need to think of how we create resilience for future crises. Climate change is looming, that we need to build solidarity and community across borders. So there are broad coalitions that speak to the idea of what we call a healthy recovery or a just transition. In this case, this slide shows a project that's been coordinated by a group called 90 by 2030, and it speaks to what is called a just energy transition. So the just component of this transition talks about legislation and policy to protect workers in these legacy energy systems where jobs are at risk. So how do we repurpose and retrain our people in the coal fields so that we provide adequate resources to enable this transformative energy transition, so that it really does benefit people and the environment. We can't leave people behind. And then the final slide that I want to talk to is this cartoon, which kind of talks about what is a bigger picture. You know, COVID-19, if anything, has exposed the fault lines that we have a profoundly unequal society. Our public health system is, for example, weakest where it's needed the most. Our education system is also weakest where it's needed the most in the rural areas in South Africa. And if COVID has taught us anything, it's that we all place a high value on our health, and that when we are asked to make sacrifices, people are willing to make those sacrifices. You know, we're willing to sacrifice our freedoms so that we can protect our health. So for us to have health equity, climate justice, and secure work in a secure future, we have to think about what is coming at us. And climate change is definitely the thing that is coming at us. And we need, if anything, COVID has taught us that we need to be much, much better prepared for climate change. A new model must emerge from this crisis, a model that protects people's health, that protects the climate, ecological resources, the things that we need to be healthy, the air that we breathe, the water we drink, the soil, and that this model has to be a sustainable model of production and consumption, and it must be equitable, and it must be just. It must meet people's basic needs, and it can't leave anybody behind. And that's it from me. Thank you.
Thank you, Rico. So finally, I'd just like to invite you to join our interest group's call for public health leadership for healthy recovery in South Africa. In July, we wrote to the Minister of Health, Minister of the Environment, Minister of Mineral Resources and Energy, and to our President to call for strong leadership in building a post-COVID-19 South Africa. The Saturday Star newspaper published extracts from the letter, and here's a photo of the Minister of Environmental Affairs, Barbara Creasy, whose office responded just yesterday to say that they're still working on the terms of reference of the Presidential Climate Change Commission for cabinet approval. So we're disappointed that this has been dragging on, and we'll keep following up for responses from them and from the other departments that we addressed. So here's our screenshot from our website. You can follow us on Twitter and join one of our campaigns in collaboration with other clean energy advocates like Groundwork, the Climate Justice Coalition, the Centre for Environmental Rights, and Fossil Free South Africa. And in closing, I'd like you to urge you to support a petition from Fossil Free South Africa for UCT to divest 5% of its endowment this year, and to work with other institutions to build ethical, climate-friendly investments in South Africa. As we wrote to the new UCT Council just this week, and I quote from the letter, as a group with a special interest in the links between climate and energy systems and public health, in a national association of public health professionals and advocates, that's the Public Health Association of South Africa, and in a country both historically responsible for and increasingly vulnerable to climate change, we call for strong leadership by UCT on urgently finding shared solutions to the converging crises of the coronavirus and climate health pandemics in South Africa. Thank you.
So, thank you very much to James and Rico for taking us through multiple stages of thought-provoking issues related to the interrelationship between air pollution and the COVID crisis. I just wanted to make a comment. James, you may be interested that UCT actually has a responsible investment strategy that will be coming out in October, and perhaps it's a response to the letter and the activity by those who are trying to get UCT to disinvest. So I open it up now to the audience for questions, and I ask you if you could please use your raise hand function and see if there are any questions for either Rico or James. Can use the, if your hand function is not working, you're welcome to just take off your mic. I see there's a hand, one moment. Leslie, please go ahead.
Hi, so thanks very much, Rico and James. So I should start off with a disclaimer of conflict of interest. So I serve on the university's responsible investment panel, and just to correct you, it's an advisory panel. So it will be coming up with a proposal, but it doesn't dictate investment in the university. And it is quite true that the guidance that is coming out is in response to advocacy by fossil-free groups, not necessarily this letter per se, but from before. Anyway, my comment is this. So the experience with alcohol and COVID has made it very clear in the public eye that we have to do something about alcohol. You know, before COVID, there was no narrative around alcohol as harmful, but if you look now, even business newspapers are talking about the way in which alcohol impacts the economy. The problem, of course, is that it's such a direct link between people boozing it up and ending up in a trauma unit. But it's really hard to make the same link for climate. So is there some way in which the narrative could be changed to make that link much more clear? Because that is kind of part of winning the public debate, is getting the public to support a clear link. Anyway, I just pose that as a difficult question.
I think day zero showed us, what we can expect in the future from more extreme droughts in the Western Cape, and so the issue of water scarcity and the resultant impacts on the agricultural sector and amongst others was a very powerful message and warning about climate change impacts. But I agree that often the bigger picture of climate change is not paid sufficient attention to, but that is increasingly changing. Rico?
I would add that in the Highveld, people experiencing climate change are those people who are affected by air pollution. So it's people who have sick kids, who are sick all the time, who live on the fence line of the coal-fired power stations, but rely on burning coal indoors for spatial heating and cooking. It's that's the face of climate change in South Africa in the Highveld. The global face of climate change right now, are these intense fires in California, the big fires in Australia, and that's kind of incumbent on us. We need to make those interconnections a lot clearer. So in the same way as COVID-19 has exposed our fragile education system in rural areas, and how that ministry has come under intense scrutiny and intense criticism, we need to do the same of our health and environment ministries. And the fault line in South Africa is that our Department of Health takes very little interest or participation in the governance of the environmental determinants of health. So the Department of Health is largely absent in the overall kind of governance of air pollution. It doesn't quantify the impact of air pollution. It doesn't do that. So like alcohol and COVID and those direct links were made, if we were to convince our National Department of Health to take a more active role in making those interconnections, I think we will begin to see a different kind of national narrative around the issue.
Thanks for that, Rico and James. Are there other questions or comments that the audience would like to make?
While we're waiting for that, I can just say I've added the link to that UCT petition. And I think one of the things that Fossil-Free South Africa has done is to point out the analogy of the divestment campaign against apartheid South Africa that really helped to shift the balance in favor of negotiations in the new South Africa, and the global divestment from fossil fuels campaign that is depriving the fossil fuel companies, often funded by taxpayers, of the social license that they've had to pollute and to continue to destroy environments. And I think all of us are invested in different ways, and so divestment is a powerful way of making the economic case, even if people aren't moved by the environmental and ethical case. I really just encourage everyone to look at what Fossil-Free UCT has been doing for the last 7 years, getting votes through the convocation and trying to get UCT to live up to its sustainability commitments.
Thanks, James. Before I come to you, Tsepo, I just want to say Leslie has made this comment about a student perhaps having a practicum, and just to let you know, we actually have a MPH student in the environmental health track that will be looking with James and I at COVID and air pollution. Tsepo, who's also an MPH student, would you like to make a comment or ask a question?
Hi, Prof. I would like to. Okay, I wanted to actually agree with Rico regarding the role of National Department of Health in terms of air pollution, particularly. So, which exactly right now it's being more headed by the environmental affairs, which makes it very difficult for the space, especially for environmental practitioners, to take a lead in trying to work towards maybe now how air pollution is affecting COVID-19 patients. So, which was a point of discussion in last year's National Environmental Health conference, where we indicated that the role has shrinked for EHPs, and it has mainly been now with the Department of Environmental Affairs, thus making it quite difficult for us to look at these areas very, very clearly.
Thanks, Tsepo. That's a very good point about the fragmentation in managing these issues and how the Department of Health isn't necessarily taking the lead. Do you want to comment on that, Rico or James, on Tsepo's comment?
Only to say that within the Department of Health, there is an environmental health directorate, and they they're understaffed and they have a very limited scope of work. Some of you might have worked with them in the past on chemicals. They're responsible for notifiable diseases, things like that. So they are very much a Cinderella kind of directorate within what appears to be a kind of a Cinderella ministry. Our ministries of energy and minerals are much stronger than our ministries of health and our ministries of environment. And in some cases, in our experience, even subservient to them. So yeah, that is a problem. It's these unequal power relations are really kind of indicative. You see the outcome on the ground, and the idea of development. What is development? Development for whom? James was talking about divestment. Anglo-American, Exaro, they all divesting from coal in the Highveld. They kind of see the writing on the wall. So they selling their coal interests to what are called the miners. In the past they were the majors. So they're selling them to the miners. The miners are generally politically connected, emerging businessmen. But sadly, what happens in reality is they sell the legacy. They sell the environmental legacy with that. So who's going to be more responsible about acid mine drainage or about a lasting environmental legacy in the Highveld? A major transnational corporation or a miner, who is in it to make a quick buck for the next 10, 15 years and then wants to get out of coal. So those are also interesting and questions that we need to ask.
Thanks for that, Rico. Yeah. James, did you want to make another comment?
Just to say that the involvement of the youth in protests around the world, as typified by Greta Thunberg and others, is remarkable and has certainly helped to propel climate change and our fossil fuel economy into headlines around the world. And I think we can expect more of that. And it's encouraging that young activists are stepping up for this fight. But yeah, we need to really act urgently. And of course, it's disappointing that our government, in a country that is historically responsible for a large share of global emissions, with a large coal-fired power industry, has been so slow to react and to live up to the climate change commitments that it's made over the last decade at least. So this is really, a call for South Africans from across the board to be part of this campaign and to, connect with advocacy organizations where you are. Thanks.
Thanks. So Tatum, who is also an MPH student in the environmental health track, has internet connectivity issues, but has posted a question to both of you, James and Rico, in the comments section. So she was wondering if there's evidence for areas within South Africa with high air pollution and an increase of COVID cases.
I'm not aware of any yet. As I pointed out in the critique of those other studies, these sort of ecological studies really require high quality spatial and temporal data of air pollution and COVID cases and mortality. And it certainly seems like we have a deficiency in all that data. Rico can probably say more about the air quality monitoring data, which is meant to be done by the Department of Environmental Affairs, but is not being properly done. And then we also know about problems with tracking the cases and deaths from the COVID pandemic. So I think we're quite a way off from getting the kind of high quality studies that are called for in that journal critique of the ecological studies. Rico?
Thanks. Rico? Yep.
Yeah, I would support that, James. Having said that, though, the biological mechanism that air pollution has, the physiological impact on health is quite well understood. we can make the associations between deaths linked to outdoor and household air pollution. We can make those associations for deaths that are due to pneumonia, that are from stroke, from heart disease, from chronic obstructive pulmonary disease, from lung cancer. So I think that retrospectively, the science will be able to make stronger associations. What I do want to say, though, which is important, is that the science linking air pollution and global deaths, that science is unequivocal. It's very well understood, and it has been, for the last 30 years. It's been getting better all the time, and the associations between increments in air pollution and increments in health outcomes, that science is also quite well understood.
Thanks for that. And Tsepo has posted a comment that you can look at in relation to districts with COVID cases, and I'm assuming the association with SASL. I think one of the big challenges that we have in environmental health is one of the points that both of you have raised, and it's this attribution in terms of exposures, and can you actually attribute it an environmental factor to a health outcome? And in many cases, there are indirect associations, and that these environmental factors play a role in sort of making the health outcome more problematic, and not necessarily causing the health outcome directly. So I think this is a challenge, and it's a challenge for all of us, particularly now with COVID, to sit back and look at the issues and the role that mitigating and modifiable environmental factors plays. And I think Leslie's point is something that we should all reflect on, is, how can we actually bring the air pollution issues to the forefront? And also, people have fatigue. You see it already with COVID. There's fatigue in terms of how long people can sustain their behavior changes. And therefore, one needs to look much broader at the structural changes that then foster behavioral changes automatically. And one of the things I was reflecting on while you were talking about the WHO manifesto, we're hit all the time with a list of suggestions, but where does one begin? Where do we start, and what would be the most priority and pressing starting point? So I'm going to conclude that and leave you all to think about where in your domain you can begin, and where we should begin collectively as a collective. And James and Rico have given us many ideas and suggestions. So I thank Rico and James very much for taking us through a very thorough and thought-provoking presentation, and thank you for your time. And I thank all the 40 participants who were on for listening and the contributions made. And I wish you all a good day and stay safe. Thank you, and bye for now.
Thank you. Bye-bye.
Thanks, Sandra, and bye.